Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be diving into the cardiac rehab phases. So let's kick off this episode with a practice question. A patient is 4 weeks post myocardial infarction. They are in an outpatient rehab clinic performing monitored aerobic exercise on a treadmill, along with light resistance training. Which phase of cardiac rehabilitation is the patient currently in? Option A, phase 1. Option B, phase 2. Option C, phase 3. Or option D, phase 4. Okay, let's start with breaking down each of these phases to get a better idea of what phase our patient is in. Remember, our patient for this practice question is 4 weeks post myocardial infarction in an outpatient rehab clinic performing monitored aerobic exercises on a treadmill with light resistance training. So first up, phase 1. Phase 1 is in an inpatient setting. This is right after the cardiac event, such as a myocardial infarction or MI, a CABG, or so many other conditions. Focus here is on safe mobility, self-care, education, and preventing deconditioning. Think short bouts of walking in the hospital, vitals constantly being monitored, and teaching energy conservation. Option B is phase 2. Phase 2 is now in that early outpatient setting. This usually starts around 2 to 12 weeks after an event. Patients are closely monitored on telemetry while doing aerobic exercises and starting some very light resistance training. This is right where our patient fits in. Remember, that patient is 4 weeks post MI or myocardial infarction, doing structured monitored exercises with some light resistance training. So option B is the correct answer choice. But let's review phase 3 and 4. Phase 3 is also in the outpatient setting, but this is a little bit later on. Here, there's going to be less supervision. Our patients are going to be progressing through aerobic and resistance training programs and begin working towards more independence. And now, option D, or phase 4. Phase 4 is lifelong maintenance. At this point, patients are exercising independently with the goal of reducing risk factors and living a healthy lifestyle. So again, option B, phase 2, would be the correct answer choice here. So let's review those key points. Phase 1, in the hospital, just starting to move, learn, and get some confidence back. Phase 2, they're being wired up and watched. They're being monitored through aerobic exercises with some light resistance training in that early outpatient setting. Phase 3, we're starting to take those training wheels off. Less supervision, they're starting to progress independently. And now phase 4 is that life phase. They are now independent with lifelong fitness goals, working on those overall health and management strategies. So another way to think of this is thinking of our cardiac rehab phases like learning to ride a bike. Phase 1 is they're just standing next to the bike, starting some hospital mobility. Phase 2, now they're on the bike, but that bike has those training wheels. They're still going through some close monitoring. Phase 3, think of it like the parents now jogging alongside the bike, but you're not actually holding on to the bike. So less supervision. And then phase 4, those parents are no longer jogging at the side of the bike. They have let their child go. That kid is now riding off on their own. They are independent, and that is phase 4. Another pro tip, the boards loves to test questions on timing. They love to ask when each phase of cardiac rehabilitation is occurring and what level of monitoring would be appropriate. I hope you found this episode reviewing cardiac rehab phases helpful. Remember, warriors, you are powerful, you are strong, and you are a final frontier warrior. You will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, X, and TikTok. Till next time, have a great day and a powerful tomorrow.